Good morning, dear colleagues, dear participants in this session on climate change and health. My name is Schweizer, and I'm a scientist for climate change and health at the World Health Organization. And it's a pleasure to be talking to you about the climate crisis, what it means for health, and what the response should be. The evidence on global warming is clear. It's getting hotter. Warming varies around the world, but the pattern is consistent. No matter where you live, higher temperatures are becoming the new normal. And it's not going to get better. In 2022, the IPCC confirmed that without aggressive carbon emission cuts, we're currently looking at a projected warming of 4 degrees by the end of this century. One important aspect here is that there is a possibility of low probability but high impact events being potentially much higher. For example, sea level rise might be much higher than the expected range of the development scenarios that are being considered. The other aspect are weather extremes, which are expected to increase in frequency and intensity. For example, for heat waves, in a scenario of 4 degrees global warming by the end of this century, we would see extreme heat events that used to occur only once in 50 years to start happening almost every year. As a consequence, climate change has been identified as the greatest health challenge of the 21st century. It is bringing more deadly extreme heat and wildfires, increasing non-communicable diseases, and facilitating the emergence and spread of infectious diseases, contributing to health emergencies. It's impacting the health workforce and infrastructure, reducing our capacity to provide universal health coverage. More fundamentally, climate shocks and growing stresses, such as droughts and rising sea levels, are undermining the environmental and social determinants of physical and mental health, from clean air and water to sustainable food systems to our livelihoods. The sixth assessment report of the IPCC estimates that up to 3.6 billion people are living in contexts that are highly vulnerable to the impacts of climate change. But not everybody is equally impacted. For an example, I'd like to hand over to my colleague, Sylvia Garry, for a quick view on the health of displaced and migrant populations in the context of climate change.
Climate change is being increasingly recognised as having both direct and indirect effects, which contribute to population movement and displacement. These drivers of migration and displacement vary hugely. They include slower onset, for example, droughts and rising sea levels, such as seen in the small island developing states. They include sudden onset events, such as wildfires and floods. And they include the broader indirect impacts, such as food, water insecurity, and changes in employment, for example, farming due to land changes. Other factors which contribute to population movement include the social, geographic, and financial conditions of individuals and of communities. Displaced and migrant populations tend to be in more precarious situations than the general population. They face increased health hazards all along their route and often have difficulties accessing services, for example, due to stigma. In other words, generally, displaced and migrant populations may have poorer health outcomes. This is also an issue of equity, as populations affected by displacement tend to be those least likely to adapt, which means communities and individuals in low middle income countries. The slide shows an example of the climate change migration health nexus to try and understand the complex interactions between these three factors, to try and think of approaches to improve the health of these populations and strengthen health systems. Much of the movement of populations in the context of climate change is expected to be internal displacement. However, generally information is lacking. Estimates for how climate change impacts population movement and health are enormously wide-ranging, and much is based on projections, as you can see a couple of examples on the slide. There are gaps at all levels in terms of how those who displace and migrate are represented in terms of indicators. There's also an urgent need for better research to understand these populations, to better identify those at risk, and to guide policies and services.
Thank you. So from a global health perspective, WHO has identified three challenges for the health response to the climate crisis. Health must be protected from the wide range of impacts of climate change. For this, we need to assess health vulnerabilities and develop health adaptation plans. We need to implement climate-informed health surveillance and response systems for risks such as extreme heat. These elements all require the availability of accessible and reliable data across sectors, such as meteorological and health data, of course, to operate and be effective in protecting people's health. We also need to build better, more climate resilient and environmentally sustainable health systems that can anticipate, respond to, cope with, and recover from climate related shocks and stress. Health also has a carbon footprint itself. We must reduce carbon emissions of the healthcare industry. The healthcare sector is responsible for almost 5% of global greenhouse gas emissions. We also need to promote actions beyond the healthcare sector that both reduce carbon emissions and improve health, the so-called health co-benefits of mitigation action. This includes supporting, for example, a rapid and equitable transition to clean energy. Now, WHO contributes to tackling these three challenges with three main approaches: leadership and awareness raising, capacity building and country support, and evidence and monitoring. I will talk briefly about each of these three areas. WHO has been raising the political ambition by emphasizing climate change's health implications, aiming to centralize health in climate policies and negotiations, including through the UNFCCC. Last year's COP meeting has, for the first time ever, dedicated an entire day to health. And the ATTACH initiative of the WHO has already gathered over 80 countries that commit to making their health systems climate resilient and reducing its carbon emissions. WHO has been placing a big emphasis on tackling climate change as an existential threat to health. And just 2 weeks ago, the member states of the WHO have adopted a new general program of work in which responding to and protecting health from climate change is one of 6 strategic objectives. WHO's core function is supporting countries in adapting to climate change, protecting health, and focusing on collaboration across the relevant sectors, providing guidance on interventions and tools for the assessment and planning, hands-on training, and support for project preparations and project execution, as well as for securing international climate and health funding. Since the early 1990s, WHO has been highlighting the health impacts from climate change. Since then, we have moved from more global reports to also more locally relevant country information. The emphasis is always on enabling effective policies and, very importantly, enhancing access to knowledge and data through evidence summaries, but also developing methods and approaches that countries can apply themselves. One specific activity and core function is the tracking of global progress towards the 3 challenges mentioned before. We do this through a triennial global survey of ministries of health. Through this, we gather mainly qualitative data from countries on national health and climate change policies and plans, vulnerability and adaptation assessments, surveillance activities, capacity building, financing of all such activities, etc. After 2018 and 2021, we are now about to launch the 3rd such global survey and expect the results by the end of this year. One ongoing effort that might also be of particular interest to you is the need for indicators to measure some of the objectives that the member states of the WHO have put forth, such as, for example, the resilience of health systems to climate change. Building on WHO's operational framework, we are currently developing a composite index of 10 indicators that would give us an overall score of the resilience of a country's health system. There is a draft version available now, and we are deploying that through the previously mentioned global survey this year. A final aspect here is also to guide the creation of evidence that facilitates and supports countries in tackling climate change. There is already a wealth of information and evidence available that allows us to take action on all of the three mentioned challenges. But there are still also gaps in our understanding, and almost 50% of countries reporting in the WHO Global Survey indicated that insufficient evidence and research is a key barrier for them to implement national health and climate change action plans. And so WHO is currently running a global consultation on identifying research priorities to create the required evidence that would enable more and better action on climate change and health. This new agenda for research for action on climate change and health, we call it short REACH, is being developed with a very broad range of stakeholders from various fields relevant to climate and health, and ranging from researchers, so those who produce the evidence, to policymakers and implementers, meaning those who use the evidence. The consultations are ongoing, and we expect to finalize the research agenda by the end of 2024. Thank you very much for your attention and for the opportunity to speak to you today.